An 18-state outbreak of severe intestinal illness is tearing through the country right now. But the source driving these infections is entirely removed from undercooked meat or spoiled dairy. Patients are getting sick from the healthiest, freshest foods of the summer harvest, produce like basil, cilantro, and berries. The people checking into urgent care clinics are describing sudden, explosive gastrointestinal distress. And unlike a standard stomach bug that clears up after a miserable 24 hours, this illness drags on for weeks. The culprit is Cyclospora cayetanensis. It is a microscopic, single-celled parasite that thrives in tropical and subtropical regions. Uniquely, it relies exclusively on humans as its host. Standard agricultural chlorine treatments, the chemicals usually trusted to sanitize our produce supply, are completely ineffective against it. You also cannot simply rinse this parasite off your salad in the kitchen sink. Because the pathogen is invisible to the naked eye, flavorless, and highly resistant to chemical intervention, consumers unknowingly ingest it. It initiates a stealth invasion deep inside the digestive tract that the host has no way of detecting until the damage is already done. The infection begins when a person swallows an oocyst. This is a dormant, heavily armored shell that houses the parasite. It is so tough that it easily survives the highly acidic environment of the human stomach. Once it reaches the small intestine, specific chemical conditions in the host trigger the shell to break open, a process known as excistation. This releases mobile, comma-shaped agents called sporozoites directly into the gut. The newly released agents physically breach the epithelial cells, the protective lining of your intestinal wall, and force their way inside. Safely hidden within the host cell, the parasite begins to rapidly multiply through both sexual and asexual reproduction. The population grows exponentially until the host cell swells and violently ruptures, flooding the intestine with a new swarm of parasites. This microscopic destruction directly sabotages your macroscopic bodily functions. The mass death of those intestinal cells severely impairs the tissue's ability to absorb water and vital nutrients. For an entire week, this demolition happens silently. It is a hidden countdown to a massive systemic crisis. By the second week of the invasion, the cumulative cellular damage reaches a tipping point. The gut can no longer compensate, triggering violent bodily reactions. Patients are hit with a harsh clinical profile: sudden, explosive, watery diarrhea, accompanied by severe stomach cramping, profound fatigue, bloating, and low-grade fevers. This chart plots symptom severity over time, revealing the deceptive nature of the illness. The host's immune system mounts a temporary defense, which drives symptoms down and creates a false sense of recovery. The infection isn't over. Surviving parasites deep in the gut initiate a completely new wave of cellular invasion. Weeks later, the intense symptoms violently return. This prolonged yo-yoing pattern repeatedly drains the patient, offers a brief window of hope, and then strikes them down again. It makes cyclosporiasis uniquely punishing compared to a standard short-lived food bug. The most immediate, life-threatening risk of this weeks-long ordeal is severe, compounding dehydration and massive rapid weight loss. This prolonged systemic depletion places vulnerable populations in serious danger. The elderly and immunocompromised individuals, such as those living with HIV, are at a disproportionate risk for severe illness. If the parasite is left untreated, rare but severe long-term complications can arise outside the intestinal tract. Patients can develop chronic malabsorption, reactive arthritis, and potentially Guillain-Barré syndrome, a condition where the immune system attacks the host's nerves. What starts as a localized gastrointestinal bug cascades into permanent systemic damage if the body fails to ultimately clear the parasite. Identifying the pathogen is a significant medical hurdle. Standard microbial stool tests often miss Cyclospora entirely, requiring doctors to order specialized molecular testing or conduct targeted microscopic searches in the lab to confirm its presence. We do not have a vaccine for this. Instead, doctors rely on a targeted antibiotic combination known as TMP-SMX to successfully halt the parasite's internal reproduction cycle. Patients then face a dual-track recovery process. The antibiotic strike must be paired with an aggressive, continuous intake of fluids to counteract weeks of severe dehydration. If explosive, cyclical gastrointestinal symptoms arise during the summer months after eating fresh produce, you cannot assume it is simple food poisoning. You need to contact a healthcare provider and demand targeted medical intervention to stop the cycle.